A very good day to you all, our viewers. We are on the talk show, a branch of the Vessels of Gold, tagged Balanced Breed. Many people have been asking us the question, particularly me, why the balanced breed? The main essence of the balanced breed is to bring balance to our society and also to bring balance to the family life. And on this particular talk show, most of the things that we talk about the health aspect of the society and also the family aspect of the society, and also things that relate to women. I want you to know that the Vessels of Gold is an outreach department of the Great House Ministries. And this evening, on this particular balanced breed, we have three wonderful women that will help to expand our understanding if you are very conversant with the topic or you want to learn about the topic. So I want to encourage you this evening, please sit tight and enjoy with us the balanced breed, which is an outreach of the Vessels of Gold and also an outreach of the Great House Ministries. And this evening, we will be discussing on menopause, a very, very important topic that deals with the women. This also gives room to the men to also listen so that they can also help their wives and maybe their sisters or their relative when this shows up in their life. With me this evening, anchoring the show is our sister, Fina, and she has two medical personnel with her. On my right is Dr. Amaka, and on my left is Mrs. Sarah Talatu. Dr. Amaka is also a medical personnel, and Mrs. Sarah Talatu is also a medical personnel. So please, just sit, ask your questions. Make sure you have a cup of juice or a cup of water in front of you as we rub mind together and we unfold about this topic. If we don't finish today, we will also continue by next week. God bless you. My name is BC Jeremiah.
Thank you, Ma. Hello, good evening, and welcome to Balanced Breed. Just like you just heard, Balanced Breed is a program brought to you by Vessels of Gold. So this evening, like you heard, we'll be talking menopause, a natural decline in reproductive hormones when a woman reaches 40s or 50s. Every day you come online, you see people happy, celebrating the 40th, the fourth ladder. How would I put it? The fourth ladder. People are excited. Women are excited. They are excited turning 40. You see all manner of photos. People go to studios. They take pictures. Some even go as far as celebrating their 40th birthday. It's an exciting era for a lot of women because over the years in the 20s, you've been filled with a lot of hormones. You've been raging, fertility, having children, menstrual cycles, keeping tabs with menses, monthly cycles. You want to know, have I missed my period? Is baby coming? Now you've hit 40. What next in 40? A lot of people are scared. This thing, menopause, what is it about? When is it starting? When is it setting in? Am I starting early? Am I starting late? These are issues women ponder with daily. And tonight, we want to look at these issues and break them down in such a way that every woman who is excited turning 40 or who has seen 50 but yet to attend menopause will be excited learning from. And at the end of the day, prepare yourself for this biological clock that we can't, I don't know if we can change it. We'll get to find out this evening if there's anything we need to do. So this evening with me, like you heard, Dr. Amaka is here. So we're looking at menopause, like I said earlier. Now, this menopause, what are exactly the symptoms that we should be looking at as menopause sets in?
Okay, good evening, viewers, once more. Today, this evening, we're looking at a very, very important topic, which is a very natural process that happens in every woman's life. It's a normal part of aging. It's a natural process. There's nothing we can do about it. Simply, menopause is the season of the monthly menstrual cycle, that is the menstruation, for a period of consecutive 12 months. When that happens, we say that a woman has entered menopause. And like our uncle said, it's actually a winding down of a woman's reproductive years, and usually happens in the 40s and in the 50s, though it could be lower in age. When a woman hits 40, the body begins to change. The hormones begin to wind down. The secretion reduces. We're going to look at that later. But I also want to remind us this evening that at times we have women who are less than 40 that have started the process of menopause. But for now, we'll hold on and we'll discuss that later. But I just want us to know that there is nothing to fear about menopause. There should be no anxiety because it's the winding down of our reproductive years. Thank you.
I'm curious. Women less than 40. Is it a surprising thing for a woman less than 40 to? I'm curious. I haven't heard of that before happening. Is it possible for a woman less than 40, like 35 or something, to start menopause? Wow.
It's possible.
Okay.
Though we used to have this, the age variation between 35 to 55. But even less than 35, I've seen one. It's possible.
It's actually called premature menopause. When it happens below the age of 40, it's called premature. It's still possible. When it happens below the age of 45, it is called early menopause.
Okay.
But the range that is mostly captures most women is between the ages of 45 and 55. So, but it can happen below that.
Okay, so if it comes like, let's say, from 35,
Yeah, it's
we
called
say
premature.
it's premature
Yes,
uh,
menopause.
menopause.
If it comes lower than 45, but more than 40, it's called early. But if it comes after 45 to 55, it's the normal range.
Okay, I'm kind of curious on this premature menopause. I'm
Yeah.
curious. Is it possible that it could have been caused by something, or is it genetical?
Like, we know that the human body differs. It could be genetical.
Okay.
It could be that there's nothing wrong with the person. It could be surgical. It could be a disease condition that could cause it.
Okay.
It could also be natural.
Okay, that means it's not like it's a common scenario.
It's not very common, but at least we've seen quite a number.
Okay.
Yes.
Okay. Okay, so that means one should be expectant, not necessarily just saying I must hit 50 ladder or I must hit 45 ladder before I menopause.
Yes.
So
It
that is
varies
like,
on individual.
it depends on the individual. So that means, so long as you're a woman and you hit that childbearing stage, you've done 20s, you've done early 30s, anything can come in.
At any time.
Nobody prays for that, particularly when a woman maybe marries very late.
You understand? Because that's what
You
I'm going
understand?
into.
Some people, like, I have a sister that married at 38. So you can imagine if she started
Menopause at
menopause
35.
at 35.
Wow.
Okay, but what I have noticed is that there is a genetic, maybe if you look at your mother and look at your grandmother, you'll be able to tell that, okay, maybe I fall within
This class.
this class. Majority of the women come in between 45 and 55. And that is not to say, like I said before, if there is no medical condition, like we have women with this, I think, hyperthyroidism, also it affects because of the years. Then you have also people who have removed their uterus, hysterectomy.
Okay.
It
Okay,
could
maybe as a
affect.
result of childbearing issues.
Yes, or could be maybe CA, cancer, or whatever
Okay.
medical condition that leads to the removal of the womb. Or in some cases, they remove the womb, but without the ovaries going.
Oh, wow.
Okay, there are so many presentations. But in case of any medical presentation at all, it happens that it could happen before that time, but it also happens naturally.
Wow.
Then we
Yeah.
also have what we call hormonal imbalance.
Okay.
Can lead to early menopause.
Yes, I think this hormonal imbalance is a lot of
Yes.
issues with fertility.
Yes.
I quite know a few women battling hormonal imbalance.
Yes.
And sometimes it brings about irregular menstruation or
That's
seizure
part of
in menstruation
Totally.
completely.
Exactly.
Okay, so let's say, for instance, now I know someone who hasn't menstruated for like 2 years, and she's within the age range of 35. I think she should be like 35, 36. And she hasn't seen period for like 2 years now. She should be worried that she could be finding herself in that early menopause, pre-menopause stage. Is it likely or?
It depends
Yes.
on what her medical history is.
That is it.
Okay.
Medical
Prior
history
to
is
the
very
cessation,
important.
yes, prior to the cessation of the period, she was having normal flow. Fine. Now, if there is no medical condition that has been associated with her in any way, okay, then you could say that she is beginning to set in. Or there's something, before the menopause starts, there is this decrease in the estrogen, the hormones that are responsible for,
Okay,
the
that
menstrual
means
period.
it's not like maybe outrightly you just stop. Maybe the period, instead of like 5 days flow, it begins to like come down to like 3 days.
It becomes irregular.
Irregular,
It
and
can
then
be heavy. It could be light.
it could be light.
It could last for 5 days. It could last for 7 days. It could last for
10
3 days.
days.
Just irregularities like that. But in her own case, probably she may have to, see her physician because 2 years is a long time. Irregularity, we're talking about months, but 2 years at a go without maybe
24 months.
Yeah, because I know she's seen
should see
her
the med.
gynae. She's seen her gynae, and she's been through a lot of treatments. Yes, she's going through treatment. So I'm kind of wondering and hoping this is not it, because she should still have more children.
If
She's
she has had a
expectant.
chemotherapy,
No, she hasn't. I don't think so.
it
I
could
think
also
that is
affect.
true. Okay, chemo likely
Yes,
could also
yes, it
trigger
could damage
pre-
the ovaries and then
Okay.
stops the secretion
Okay,
of
so
hormones.
automatically what it means is that if the ovaries are damaged or infected,
Are damaged.
are damaged most especially, okay, maybe likely from either infection or
They're not performing
chemo
their
or anything
functions.
like that.
Yes.
Okay, so it can actually lead to, well, this is a new knowledge for me actually.
Yeah.
This is a new knowledge. But in this case now, for the pre-menopausal stage now, okay, like I said, maybe like you said, maybe if the period has delayed or for like a longer period of time. Now, what are the likable signs aside from the menstrual flow not coming in as a monthly, night assists? What are other signs? What likely signs aside this period can we be worried about when we begin to feel that we say, okay, it's like I'm finding myself, like I'm
Okay.
finding myself here.
The commonest symptoms that is associated with menopause, we have hot flashes, night sweat, cold flashes, vaginal dryness. We have urinary urgency, presents in different forms. We have insomnia, that's difficulty in sleeping. Then emotional changes, a lot. Irritability, mood swing, depression. You have dry eyes, dry skin, and so on and so forth. These ones are actually directly associated with menopause. But prior to the menopause, that is what we call the perimenopause. That
Okay.
is before the menopause, when already the hormones that are being secreted by the ovaries begin to decline. You could also have some, peculiar symptoms, may or may not with some people. Like breast tenderness could be there. Like what we said earlier, irregular periods could be heavy, it could be light, it could present in any form.
Dr. Maka, let me
Okay.
cut you. Let me cut you, sorry. I won't cut you based on some of these early symptoms you listed,
Okay?
like the hot flashes, night sweats.
Yes.
I remember with my last pregnancy, and I remember one day you saw me, you were asking me, this one I'm sweating like this. I came down with a lot of, I didn't know I was pregnant as at then, but I just knew that I was sweating profusely. Sweating that my hanky could soak. I didn't know actually that I was pregnant. I think I was far like 2 months gone before I realized I was pregnant. But I came down with some symptoms that were strange for me for pregnancy. Haven't been through series of pregnancy. So now for someone who is hearing some of these symptoms you're listing now, if I was like that period now, I'll be worried. hearing, if unless I'm watching now, and I know that one or two symptoms are linking to me now, begin to get scared. It's like I'm menopausing early.
No, well, pregnancy has to deal with hormones.
Yes.
Okay? Menopause also has to deal with decline in hormones. All right? Now, in pregnancy, what we call your basic metabolic rate is naturally increased. Like there's weight gain. It's just like when there's more fat. Somebody who is fatter sweats more than somebody who is not. Although I've seen very slim people sweat very, very much, okay? Now, pregnancy has its own, with time, even breast tenderness comes with pregnancy too. Yeah, it comes with
That's
pregnancy.
one of the symptoms I was listening.
But if you check those 2 months, probably you wouldn't have seen your period. Maybe your mind wasn't there.
My mind wasn't there, actually.
There are some things that are very specific to pregnancy that you don't need to, become confused and say, okay, I'm sweating too much, night sweat. Even in pregnancy, you don't sweat really much in the night, except when you are heavy and you have added some weight and you're
That
uncomfortable.
sweat was something else. At night, I will soak my bed. In the daytime, it's like the weather is calm like this, but I'm sweating. At a point, she asked me, I remember one day she saw me and I was soaked in the market. And then this one, you're sweating like this, I'd be like, I don't even know why. But I just knew that the sweat was out of place for me. And then my skin was going through some kind of tough time. I had redness all over. I've never seen that kind of symptom for pregnancy.
Okay.
Before.
And
So
what I want
that was
to
why I was
also,
saying that it could actually trigger fear for
what
someone.
I want to add, when we are diagnosing, I don't want to like to use the word diagnose because it's not a disease condition, but let's just use it for the purpose of this, what we are discussing. When you are diagnosing menopause, we said consecutively for 12 months.
Okay, 12 calendar months.
12 calendar months.
So that automatically rules out
Yes,
whatever
so,
it was I
yes,
was
so
feeling.
that automatically
rules it out.
You don't-
Okay.
you
So
don't
please don't
have
be
to
scared, though, if you feel like me.
Because like that your case as a midwife,
Yes.
there could be an underlying cause. Maybe you were even hungry as of that day. Maybe you've not eaten food.
Okay.
And there is maybe excessive breakdown of glucose in your system
Okay.
that can lead to that.
That's sweating.
Yeah.
It was strange, actually. Okay, so let's not panic. Like you heard them, please, viewers, please don't panic. But adventure, you start sweating like I did. Please don't panic. They said it's not menopause. You still have to miss your period for 12 months before you begin to worry or panic. Okay. Okay, so let's go further into that, the stronger symptoms, the real symptoms themselves.
That's what we have said earlier, hot flashes. Like we are dark skinned.
Yes.
Okay, you are fair skinned, of
Yeah.
course. So if let me use the word, borrow the word, Oyibo people call flushing, you are blushing.
Yeah, blushing.
That kind of thing. There's a sudden flow of blood,
Okay.
to the skin, and then after it relieves the person, there's a kind of cool, at times it's chill.
Yeah.
You feel cool.
As a result
Yeah.
of the excess
Yes,
sweat.
yes. Then night sweat, you can't miss that one, night sweat. Then at times you feel like chills, cold, as if you are cold.
Okay.
I'm beginning to feel those things now, so I
And
can
start
tell that
asking
then.
questions and start asking your children, are you also feeling cold?
Yes, then you begin to ask your children, I'm
Yes.
sure, are you also feeling cold? And then,
Then
your children will be like, no.
There is no
And
cold.
then you'll be like,